This is Nevada Cancer Coalition's Cancer Talks, a public health podcast where we connect with coalition members and partners to learn more about cancer prevention, early detection, and survivorship. Hear about cancer care in Nevada and meet the people who are making an impact. Today, we're talking about Nevada's tobacco retail purchase assessment project, which is a bit of a mouthful. And we're joined by Nicole and Beatrice. Would you guys like to introduce yourselves?
Sure. My name is Nicole Chacon, and I manage the Nevada Tobacco Control and Smoke Free Coalition.
Hi everyone, my name is Beatrice Gyampo. I'm a second year MPA student in epidemiology and also an intern with Nevada Cancer Coalition.
Awesome. So, for listeners who've never heard of this project, what is the Nevada Tobacco Retail Purchase Assessment Project?
So it is a mouthful. We just completed our third year of this project. And the goal with this project is to support the Attorney General's Tobacco Enforcement Unit in Nevada. So they are the group responsible for doing retail inspections to make sure that people in tobacco retail environments are not selling to anybody under the age of 21 without checking their ID or scanning their ID. And so what we found is in the past, the retail violation rate or the RVR cannot be above 20%. So meaning of all the stores that are inspected by the Attorney General's office, they cannot have a fail rate more than 20%, or our state actually loses some substance abuse block grant funding, which we rely on to pay for a lot of different services around the state. So this project is meant to be an educational project. It's not punitive. And so when we do these assessment surveys, we are trying to educate those retailers who still don't know that they have to scan IDs for anybody who is attempting to purchase tobacco products.
So, how does this really, you said it's educational, but is there really any other difference in terms of the formal compliance inspections that the Attorney General's office does?
So the process is similar to what the Attorney General's office does. However, there are some restrictions. They aren't able to go into the rural or frontier communities, and so that's a whole huge area that is left unchecked. And in addition, they only actually do retail inspections. The requirement is only that they do them once every 3 years, which we just don't think is adequate enough. And that's just due to a lack of resources and funding in the Attorney General's office. They would love to do it more. And that's something that we have wanted to see change policy wise to increase that. But the actual process of how we send two teams in, or a team of two people into each of the places, is fairly similar when we discussed with them their process. The only difference is when the Attorney General, the Tobacco Enforcement Unit go in, they do a team of two. That person is actually under 21 years of age that they are attempting to purchase tobacco products. And so they will actually attempt to purchase them. And I believe they actually go through the purchase itself. When that happens through the Attorney General's office, they can actually cite them if they do not card or they do sell to someone under 21. And so in that process, that retailer has quite a hefty violation, a fine that they are assessed if they do fail that. For our project, we do send in a team of two, and Beatrice can talk about that because I know she's been one of them that goes into the store, but ours are not under 21. So they just attempt the purchase. We choose what we call our surveyors and our attempted purchasers to be close to 21 as possible because we want to make this as obvious as real, as credible as we can. And so when they go in and attempt to purchase, they don't follow through on that purchase. They just leave regardless. And then that surveyor, that second person actually provides the education to the clerk if they fail so that they can give them the information to make sure that they know that what their responsibilities are under the law. And they leave them a lot of educational materials. And then we also leave promotional materials so that they have things handy around their shop so that they can remember that they have to check and scan IDs every time somebody attempts to purchase tobacco.
Beatrice, obviously, you got this job in part because you're interested in public health, but you also look really young. Tell me about what it was like, an average visit to a retail location. What was that experience like?
Yeah, so let's say a typical day is like me leaving home at 8 or 9 a.m. and then coming back home at 6 or 7 p.m., where we've attended to, let's say, I think 11 shops in total. And then we have majority of the retailers passing the test that we offer to them. And it's quite amazing because I like the fact that the shops that we attend to, most of them pass the test. And then they also cooperate with us. And also, one of the interesting thing I found was moving from Reno to the rural counties, like the Douglas counties. You have to drive at least 20 to 30 minutes to the next shop, trying to locate the next shop, and then you realize the shop doesn't exist. That's how I typically say a retail day is all about. And also, I like the fact that the moment we go to the shops, we have some stand buyers who they see what we are doing, and they always acknowledge us for doing the right thing and trying to educate them to do the right thing. So basically, that's how a retail assessment, the whole day of a retail assessment is like.
So when you go to do those retail assessments, they're not upset, they're not intimidated, they're not scared. They're actually happy to see you, providing them with the education.
Yes, yes. So I think one thing I also observed was that those that pass the assessment are extremely happy, and they even offer to give us a gift for assessing them. But then we always decline the gift that they try to offer to us. And then those that fail the assessments are always angry. And then they like they look very, very disappointing for failing the assessment.
I would have taken them up if it was like bottomless Dr. Pepper with crushed ice.
That's right.
Nicole, why is education so important to this part of the process?
So in January 1st of 2023, we had new legislation that went into effect in the state of Nevada that requires all tobacco retailers to use some form of scanning ID technology. And so what we found is a lot of people just didn't know that that law went into effect. So it's not just that they can't sell to somebody under 21, but they actually need to use some form of technology to scan an ID. And so the burden falls on the clerks themselves. And we know that there's can be high turnover in that position. And so if the clerks aren't educated by the owners and the managers of the stores, then they don't know that what their responsibilities are under the law. And it's kind of consistent, I would say, across the board. To make this generalization, of course, this isn't 100%, but a lot of the retailer chain shops, they do a better job of educating each of their clerks and they know their jobs. But a lot of the small mom and pop type shops, the vape shops, they don't do as good a job. And we tend to find more failure rates in those locations overall across the state.
The scanning requirements, is that some sort of a device that they need to buy?
Yeah.
Not necessarily. So, what we found after we did the first year of the project is that a lot of people didn't know. And in addition to that, they didn't have the technology. So, in our second year of doing the project, we actually paid and created an app that they could use on their phones. So it's not something that would even be a financial responsibility for any of these locations. So that's something that we also put in our little folder of materials that we give to them after each survey. We give them a folder of materials, educating them on each of the laws that they need to follow. And there is a QR code on a postcard that they can then download those apps. And we have these materials available in English and Spanish so that there's really no barrier to any of the facilities scanning. They don't have to have something physical. They just need some of that technology. And we've provided that free of cost to them.
Okay, so I'm going to put on my tinfoil hat and be a conspiracy theorist. I don't want my ID scanned. What kind of information are they gathering? And are they storing information when they scan the IDs?
No, they're not. It's just a simple check mark that this person is 21 or not if they are scanned. And I think from the perspective of a purchaser, if you're attempting to purchase alcohol or tobacco, I think it's understood that your ID is going to be scanned by that location.
Beatrice, what surprised you most after talking with so many retailers?
So, so one of the things that I found surprising was when you go to one shop that had the posters posted in the shop that they do card or check for ID before issuing any tobacco products. And then when I went there to go and buy the products, the retailer didn't ask of my ID. And the funny thing is, it was boldly written in front of their machine that they'll be asking for ID and then scan before issuing the product. So after buying the product, and then we asked, she didn't ask of the ID. So after that, and then we tried to do some education, and then I asked her, why didn't you ask for the ID? And she said, oh, it is posted that you need to have your ID. I was like, no, yes, still, you still have to ask me since it is posted. Don't assume that I have seen and I'm less than 21 years or I'm above 21 years. So you don't have to ask. So you need to ask of the ID. And that was one. So after the education, she was like, oh, she's sorry. And then she did the right thing next time. And also, one of the things that I found interesting was that some people don't ask of the ID. They just ask of your age. How old are you? And then when I tell them, oh, I'm 20 and I'll be 21 this year, and it's like, no, I can't tell it to you. And some of them too would ask of your date of birth. But then those are asked with the dates of birth. I give the dates of birth and then they also do their own calculation and you realize I'm either below 21 or above 21. But then even with that, I still go ahead to tell them you still need to ask of the ID because I can lie of my date of birth, I can lie of my age, and then you wouldn't know unless you check my ID. So that was just some of the things I found so surprising, and we had to educate them to do the right thing.
It's funny because it's not like age restrictions on purchasing certain products are anything new. I mean, alcohol has been age restricted for years. Tobacco has been age restricted for years, although in recent years they increased it to age 21. But there have been these age restrictions for years. So it's interesting to hear that there are still challenges with getting people to f- follow the age restrictions when they're working at the counters and selling these products. Um, Nicole, how do projects like this ultimately help either improve the tobacco retail landscape or reduce tobacco use among youth?
So one of the interesting things, and I'm sure unsurprising, that's been found in some of the youth risk behavior surveillance polling that they do of youth is that they find it very easy to get tobacco products. That might be through friends or family members. But what we do need to do is cut down on their availability of getting them in the retail shops because a lot of youth have no problems going to the vape shops and buying products because they're ultimately not carded. We know that if youth don't have access to these products, they're much less likely to use them. And so that's by bringing that fail rate down, that's important because it means fewer tobacco products are in the hands of youth. About 90% of adult smokers started smoking before they were 18. And so if we can cut down that access point and choke that off, and then they're less likely to have access and they're less likely to use these products.
Were there any memorable conversations during this experience that really changed your perspective on tobacco prevention?
So I think the experience was really nice, and then I like the fact that I had to travel from one country to the other. But then I realized that most of the retailers were knowledgeable of the right thing to do by asking for the ID. That is what I observed mostly when we were doing the retailer assessment. And also, I realized that, as I said earlier, the stand buyers, those that just around us trying to buy something, and then they realize the retailer passed the assessment. Oh, they give a thumbs up, they are happy, and they also bring in a voice. And those that fail, and then they stand by it, they're just looking like, dude, you are dead. Like, they try to and tell them the next time they should do the right thing. So I think that was the memorable experience that I won't forget. And I also think that the retailer assessments during the previous years have really been impactful. Yes, has really been impactful. And I think they are doing the right thing, except some of the shops that change retailers, that change those that goes to sell. They need to train the new staffs they employ in their shops, because I realize some of the shops that we entered, the staffs are new to selling the tobacco products, and then they didn't have any idea of whether to card and then the age range of selling the tobacco products to them. So I think shops that recruit new members or new staffs into selling, they should train them and then educate them on the laws and the right thing to do when they sell out tobacco products.
Yeah, that's really important, and I think what the fine right now is about $1,000 or up to $1,000 on the actual clerk working at the store if they get caught in a punitive sting operation. Is that right?
I think it's actually $2,500. And that was a recent change in legislation. It used to be that they got a warning the first time, but now it goes immediately to a fine, and it's a hefty fine. It's pretty significant under Nevada law. Licensees caught selling tobacco or vapor products to persons under 21 face escalating civil penalties for violations occurring within a 24-month period. The first one is $2,500. The second one is $5,000. The third offense is $7,500, and the fourth or more offenses is $10,000.
Which could really hurt a lot. I mean, if they're levied against the person who's working there at the counter, that person is most likely making minimum wage or just above minimum wage. That is a lot of money in this economy for not following this law. And so I can see how the education component is not just beneficial for tobacco control, it's really beneficial for these employees who are working at the retail locations and potentially not getting the education or the orientation and training from their manager or their store owner that they could be getting. And so it's almost a service that this retail project assessment is doing for some of these workers.
So the fines are actually assessed against the licensee, the retail licensee, but the individual clerks could face some individual penalties as well. And the one thing we don't want to happen is for people to lose their jobs, right? These clerks to lose their jobs as a result of that. And that's why I think we are probably more welcome than the Attorney General's office, our surveyors, because if they are caught, not meeting their responsibility by IDing a potential customer, they want to learn that from our teams and not from the Attorney General's teams, so that they can make that change and make sure that when they are visited in their inspection that they're doing it right when there's a potential fine on the line.
Yeah, absolutely. I would welcome either of you if I was working at a shop over someone who might find me.
Exactly.
So, is there a place where if someone who works at a convenience store or a gas station or some other shop that sells tobacco, is there a place where they can go and get this information if perhaps someone like Beatrice doesn't come in and educate them? Where can they go and find that?
Oh my God. So yes, the state of Nevada actually has a website that has some different trainings and information, and it is responsibletobacconv.com. There are modular trainings that they can put themselves through in there and all information about the law. And we certainly have all of that information in the packets we're handing out as well. And one component of the project that I failed to mention is that we also did a large scale media campaign that was really targeted to reach retailers and clerks as much as possible. So we're trying to educate even those that aren't getting those visits from our teams.
Do some of the shops get visited more than once? It sounds like they get hit more than once with this education.
Yeah, so that's certainly a possibility. So for our project, our goal is to reach 30% of all the licensed tobacco retailers across the state. Now, there are some limitations. We work in Clark County and Washoe County, the two largest counties, populous counties across the state. We work in the Quad counties, which is Carson City, Douglas, Lyon, and Story. So those were all the first year. In the second year, we did those and added White Pine and Elko counties. We keep adding. So we did all of those, but this year we also added Nye County and Humboldt County. So eventually the goal would be to get to every county across the state. But each year we pull a randomized sample of 30% of all of those tobacco retail shops in each of those counties. So there's certainly a chance that shops will be revisited from one year to the next.
Beatrice, this is a great question for you because you're a public health student, right? How has this experience shaped your understanding of public health?
I believe public health is about identifying a problem and then trying to get a solution or appropriate intervention in tackling this problem. And I believe that a problem is just like a tree that has the roots, the stem, and then the branches with the leaves. And if you want to tackle a problem, you need to tackle it from the base, that's the root. So we know tobacco actually poses health risks on individuals when it comes to cancer, respiratory infections, and other chronic disease infection. And in order to prevent people from getting these particular diseases, we need to start talking to people about the right things that they need to do to be able to stay healthy. So I think the tobacco prevention initiative is actually a big one to help reduce chronic disease incidents in Nevada.
I love that metaphor. The work that you're doing is like one of the big roots coming out of the tree that is helping to feed a healthier tree. Nicole, what do you think is a misconception? Because you've been working in tobacco control for a number of years. What do you think is a big misconception that people have about tobacco prevention work specifically?
I'm not sure a misconception so much as they think it's just focused in one area. I think a lot of times when people think about tobacco control, they think about exposure to secondhand smoke in public places, things like that. And so they really only think there's that. Or maybe people just think all tobacco control work is related to cessation, helping people quit. When there are actually a number of different ways that ultimately, our goal in tobacco control is to drive down usage rates, right? So we don't want people using tobacco because we want to cut down on all of those chronic diseases. We want to make sure that from a public health perspective, but also from an economic perspective, it helps the state save a lot of money when people aren't developing these chronic diseases. So we tackle that a lot of different ways. Pricing is really important. The more expensive tobacco products are, the less people will use them. We want to restrict access, like this project helps us with. Also, with flavored tobacco products, if you don't have really exciting flavor tobacco products, then kids are less likely to use them. We don't want tobacco products marketed to children and to disproportionately to underserved communities. And then we don't want people exposed to secondhand smoke as well. So there's a lot of different things that we want to do. And prevention is the most important thing. But of course, we also want to offer access to cessation for people who already do use these products.
So it's not about demonizing tobacco use. It's really about helping people to be healthier and to have healthier environments.
Absolutely. I mean, nicotine is the most addictive product available, and we know that cigarettes were made specifically to be as addictive as possible. And that's what we're finding with some of these newer products that are exposing young people to and adults who were never smokers to nicotine. And so we don't want to demonize smokers. You know, we want to offer help. We want to be supportive in their quit attempts, but we also want to protect those that don't use tobacco products from exposure to secondhand smoke. And also, we don't want to have young people, new smokers, get into that pipeline of then becoming addicted to nicotine over their lifetime.
Beatrice, if you could change one thing about Nevada's tobacco retail environment tomorrow, what would it be?
Yes, so I think looking at how Nicole was talking about the secondhand smoking, I realized when you go to the casinos and then the gaming sites, most of the people smoke even in the midst of the people that serve them, like the bar attendants or the attendants that serve them. So one thing I would want to change is casinos or gaming sites should have a smoking room whereby secondhand smokers wouldn't be exposed, like the bar attendants or the attendants wouldn't be exposed to the smoke of, let's say, the people playing the game or whatever. So I think if that's one thing I would change, so that it won't be like people that enter the gaming room or the casino would inhale smoke at a go. Not everyone in the gaming room or the casino smokes. So I think that's the one thing I'll change. Yeah.
It's tough for some of those people that work in casinos when they don't smoke and they are breathing that all day. So, how about you, Nicole?
From a retail perspective, I think the biggest way you're going to cut down on access is flavored tobacco products. Some counties and cities across the country have started to restrict the purchase of any flavored tobacco products. When they're less enticing, less people are going to use them, including youth and specific communities that are targeted by the tobacco industry in their marketing to become addicted to specific products like menthol. So I think when we're looking at it from a retail lens, not having flavored tobacco products available would be probably the biggest thing you could do to cut down usage.
Well, thank you both so much for joining us. I think that this is such an important and interesting project that you guys have been working on. And Nicole, do you have any plans for the future? Are you going to keep the project going in the same format?
Yeah, so we are looking at another additional year of funding. Our goals are always to make sure that we can grow each year if there is funding available for that and resources available to make sure that we are reaching those underserved communities across the state. But it's also equally important to continue to visit some of the same in the urban areas as well, because we know that that's where a lot of the exposure comes in. So we're always looking for ways to improve the project each year. Like I said, moving from the first to the second year, we created that app. We started the media campaign. We have broadened our range of where we are. So our goal is to continue to make this project bigger, to maybe team up with somebody else from the University of Nevada, Reno, who does a similar project in Washoe County to see how we can collaborate with other health groups that are doing something similar, because we all have the same ultimate goal of bringing those retail violation rates down and having less access to tobacco products for you.
Awesome. Well, thank you both so much. I really appreciate your time and thanks for doing awesome work in Nevada.
Thank you.
Thank you for joining us for this episode of Cancer Talks. Learn more about us at nevadacancercoalition.org and catch more episodes of this podcast on our Substack or wherever you get your podcasts.